When we think about heart problems, what typically comes to mind? It's probably that classic movie scene. Someone clutching their chest, a sudden sharp pain, and then panic. Am I right? But what if I told you that for older adults the heart often whispers for help rather than shouting? Today, we're going to talk about this silent killer and uncover 7 subtle heart problem symptoms that are easy to overlook. I promise, some of them will genuinely surprise you. As we age, our bodies change. And so does the way they signal problems. Nerve endings may not function the same way, and our pain threshold can actually increase. That's why the classic textbook symptoms of a heart attack or heart failure are far less common in people over 65. Instead, the body sends out different, often disguised, signals. Our job, then, is to learn to recognize these subtle cues so we can get help for ourselves or our loved ones in time. So let's begin with perhaps the most insidious and common symptom: unusual fatigue. I'm not talking about that pleasant drowsiness after a big meal or the desire to just kick back after a day of gardening. No. We're talking about a sudden, overwhelming exhaustion that seems to come out of nowhere. Picture this. Just yesterday, you or a loved one could effortlessly walk up several flights of stairs, but today, each step feels like climbing Mount Everest. A simple walk to the store turns into a marathon. Even basic household chores, like washing dishes or making the bed, drain all your energy, leaving you desperate to find a place to sit down. Why does this happen? Think of your heart as a powerful pump. When this pump starts to falter, it circulates blood less efficiently, and it's blood, after all, that delivers oxygen, the crucial fuel for our muscles. When muscles don't receive enough of this vital fuel, they sound the alarm, and that alarm is precisely what you experience as a sudden, overpowering weakness. The most dangerous thing is that this symptom is often easily dismissed, blamed on age, the weather, or just about anything else. But this isn't just old age. It could be a quiet SOS signal from your heart. Next up on our list of warning signs is shortness of breath. But wait, don't jump to conclusions. We're not talking about huffing and puffing after climbing 5 flights of stairs. Cardiac-related shortness of breath is far more insidious. It often strikes when you least expect it, even when you're completely at rest. The most vivid and concerning indicator often appears at night. Someone goes to bed, falls asleep, only to wake an hour or two later with a sudden acute feeling of breathlessness, as if an invisible weight is pressing on their chest. They sit up in a panic, often swinging their legs over the side of the bed, and find that breathing gradually becomes easier. Sound familiar? To avoid these agonizing awakenings, people often start sleeping in a semi-upright position, propping themselves up with 2, 3, or even 4 pillows under their back and head. This isn't just about finding a comfortable sleeping position. It's an instinctive attempt to help their body cope. When the heart struggles to pump blood effectively, excess fluid can build up in the lungs. When lying flat, this fluid makes normal breathing incredibly difficult. But when you sit up, gravity helps to pull that fluid downwards, partially clearing the lungs. If you notice that your bed, or the bed of a loved one, has started to resemble a throne of pillows, this is a very serious and urgent reason to see a doctor immediately. Now let's talk about your legs. Have you ever noticed how your older relatives' ankles tend to swell up by evening? Their shoes start to feel tight, and the elastic from their socks leaves a deep, often unsightly mark. It's so easy to brush this off. You've probably heard all the usual excuses. I must have walked too much. I ate something salty. Or it's just hot outside. But if swelling becomes a constant companion, it could be more than just a minor annoyance. And again, it often comes down to a weakened pump. When your heart struggles to keep up with its workload, it can't effectively pump blood from your legs back up. This creates a kind of traffic jam, and excess fluid starts to seep out of your blood vessels into the surrounding tissues. And that's how the swelling develops. Initially, it might only be noticeable in the evenings and then go away after a night's rest. But over time, it can become constant. There's a simple, yet very telling test. Gently, but with a bit of pressure, press your finger into the swollen area for a couple of seconds. Now, remove your finger. If a noticeable indentation, or pit, remains on your skin and doesn't disappear right away, that's a significant cause for concern. It means a considerable amount of fluid has already built up in your tissues. Don't ignore this warning sign. Your legs might be the first to tell you there's an issue with your heart. What about sudden dizziness or even fainting spells? Most people immediately think, oh, my blood pressure must be fluctuating. And in part, that's true. But the real question is, what's causing those fluctuations? Sometimes the answer lies right in your heart. Imagine your brain as the body's most vital energy consumer. If your heart, our body's main generator, suddenly starts to falter, perhaps due to an irregular rhythm, also known as an arrhythmia, that vital power supply to your brain is briefly interrupted. This short power dip is precisely what you feel as a sudden dimming of vision, dizziness, or in severe cases, even a complete loss of consciousness. An especially concerning sign is dizziness that occurs when you stand up quickly from a bed or chair. At that moment, your heart needs to rapidly increase its output to pump blood up to your head against gravity. If it can't keep up, your brain immediately signals distress, often as lightheadedness or a feeling of faintness. So, it's not just weak blood vessels, as is commonly believed. Instead, it could be a critical call for help from a heart struggling to provide a stable blood supply to your most vital organ, your brain. The fifth symptom on our list is a true master of disguise. It often hides where you'd least expect it, in your stomach. Imagine this scenario. An older person suddenly experiences nausea, perhaps even vomiting. They might feel an unpleasant heaviness or even a sharp pain in the upper abdomen, right under the ribs. What are the first thoughts that come to mind? Naturally, I must have eaten something bad. Food poisoning, or my gastritis is acting up. The person might reach for antacids or other stomach remedies, but they offer no relief. And here lies the crucial danger. In older adults, particularly women, these digestive symptoms can actually be a sign of a heart attack, a myocardial infarction. Why? It's because the nerve endings connecting the heart and stomach are located very close together. When a cardiac event occurs, our brain can become confused, misinterpreting the source of the pain. It receives an alarm signal, but mistakenly projects it to the stomach area instead. So, if an older loved one experiences sudden and unexplained digestive issues, especially if accompanied by weakness, sweating, or shortness of breath, don't be so quick to blame last night's dinner. It's possible their heart is trying to tell them something in the most unusual way. In such a situation, it's always better to be safe than sorry. Call for emergency medical help immediately. Now let's talk about pain, but perhaps not the kind you're expecting. When you hear heart attack, your mind likely conjures a classic image. Someone clutching their left chest. Forget that cinematic stereotype. Especially in older adults, the heart frequently sends pain signals to the most unexpected parts of the body. Imagine a persistent, aching pain in your lower jaw. Your first thought might be, I need to see a dentist, or a sudden ache in your neck, shoulder, or between your shoulder blades. You might dismiss it as a crick in the neck, a draft, or my arthritis acting up again. Perhaps an uncomfortable sensation in your left arm, easily attributed to muscle strain. It's a remarkably deceptive trap, isn't it? This phenomenon is known as a referred pain. It happens because the nerve pathways from your heart and from these other body regions use the same cables to send signals to the brain. So, when the heart sends a distress signal, the brain can get muddled, mistaking the issue for something on the transmission line rather than at the power station itself. Therefore, if you or someone you know experiences unexplained, persistent pain in the jaw, neck, back, or arm, pain that isn't due to an injury and doesn't go away, don't dismiss it. It could be more than just a stiff neck or muscle ache. It might be a subtle but critical message from your heart. And finally, the seventh and perhaps most surprising symptom is one almost always dismissed as a natural part of aging. This involves sudden changes in a person's mental state and behavior. Imagine an elderly relative who has always been sharp and mentally clear suddenly becoming confused, forgetful, and disoriented. They might repeatedly ask the same questions, mix up names, or seem unsure of their surroundings. Naturally, your first thought might be to suspect dementia or Alzheimer's disease. However, sometimes the true cause lies elsewhere. Remember, we've discussed how the brain is the body's biggest consumer of oxygen. So when a weakened heart can't ensure adequate blood supply, the brain is one of the first organs to suffer from oxygen deprivation. Its normal function is disrupted. It's much like a computer slowing down and glitching when it doesn't receive enough power. Brain cells can't function properly, leading to confusion, memory loss, and apathy. The key word here is suddenly. If cognitive functions decline not gradually over many months, but sharply, literally within a few days or weeks, that's a huge red flag. This isn't just a reason to book an appointment with a neurologist. It's a crucial sign to get your heart checked immediately. And now we come to the crux of the matter, the culmination of our investigation. Have you noticed what all these symptoms have in common? Fatigue, shortness of breath, jaw pain, nausea, confusion. They seem completely unrelated, don't they? You might visit a gastroenterologist, a neurologist, or an orthopedist, yet never even consider seeing a cardiologist. And therein lies the insidious nature of this silent killer. Your heart doesn't always cry out for help with classic chest pain. Instead, it speaks a different language, sending distress signals through other bodily systems. Your brain might misinterpret the source of pain. Your lungs struggle with fluid buildup. Your legs swell due to impaired circulation. All these seemingly minor and unrelated complaints are actually pieces of one large and very dangerous puzzle. To ignore them would be like ignoring a ticking time bomb. The main takeaway from our discussion today is simple. Pay close attention to yourself and your loved ones. Don't dismiss complaints as just getting old or age-related aches and pains. Sometimes what seems like ordinary fatigue or a stomachache could be hiding a serious yet preventable threat. Thank you for watching this video all the way to the end. If you found it helpful, please give this video a like and subscribe to the channel so you don't miss future episodes. Now a question for you. Have you or your loved ones experienced any of these unusual symptoms? Share your story in the comments below. It could really help others. Stay safe and take care.